I'm a regional ombudsman over in West Central Illinois. I cover 6 counties, Hancock, Adams, Pike, Calhoun, Brown, and Schuyler counties. And what we are is we are resident directed advocates. We work at the direction of the resident towards whatever their goals are. Sometimes we're successful, sometimes we're not. And right now it's been a whole different ball game for us. So with that, a couple of disclaimers on discussion about the vaccine. I'm not a doctor, I'm not a nurse, I'm an advocate. And so my main focus is going to be on rights and some things that you can do to help and you can maybe watch out for. But I really can't speak to the effectiveness of the drugs or a lot in the testing processes that are involved. So there's my disclaimer. I really started focusing on the vaccines when I saw that AstraZeneca and QMG are working to run a test, a trial of one of their vaccines here in the Quincy area. They're one of 100 facilities, I think, across the country that are working on testing that drug. And in the article from WGEM about that trial, they said that they're going to be seeking out nursing home residents and healthcare workers for the trial. And so I wanted to talk about what residents' rights are. Now, and I think we all know that the CDC and Illinois have designated that the first doses available are going to go to long-term care residents and healthcare workers. I think that's a positive step forward. I know, just kind of poking around on the internet, I know a lot of people feel like that our seniors are being used as guinea pigs. I don't see it that way. The fact that the drugs are getting to human trials means that the actual guinea pigs that were tested on early on are still alive and are doing fine. So I see it as a positive step. Along the same lines, yesterday I was on the Nationwide page. I saw some people posting some speculation and some misinformation about the vaccines. I really encourage you, there's going to be a lot of speculation, a lot of sensationalized headlines. I really encourage you to please research before you share something. The saying from my college days was think before you link. And we want to make sure that we're sharing correct information and not scaring people away from something that could help them. Right now, there are 3 vaccines that are in the kind of the late testing phase right now: Pfizer, Moderna, and AstraZeneca. These drugs, they've been shown to be mostly safe and mostly effective. And really, the big thing that we're not going to know once the drugs are released, if the drugs are released, is their long-term effectiveness. And that's the main thing that we're not going to have. So with all that said, the main right that I wanted to talk about was that long-term care residents have the right to refuse. They have the right to refuse to take the vaccine, even if they're under a guardianship. They still have the right. They can't be coerced by family members or facilities. There should be a conversation that's had with a resident, trying to find out what their concerns are. At the end of the day, it's their choice if they want to take it or not. And I mean, that's the same thing with any other treatment, any other vaccine. But I feel like after 8 months in a global pandemic, it needs to be restated that residents have the right to refuse it. And finally, when the vaccines are released, I think it's important that as outsiders and even those who are living in long-term care, I think it's important that we have some realistic expectations in terms of the restrictions. The restrictions are not going to go away as soon as the vaccines are distributed. I believe all of the vaccines are 2-part shots. That first shot, and then I think it's about a month later when the second shot is given. So at the very, very least, you're not going to see anything change until after that second shot has taken effect. And that's, again, at the very least. Since none of the drugs have been approved, the CDC hasn't released any guidance yet as to, how long it takes for immunity to build up in a person. And they haven't released any recommendations about what regulations can be released once a person's considered immune. So I was on a call with several ombudsmen and IDPH a couple days ago, and I asked them, what we could expect in terms of the regulations to change. And their answer was that they're waiting on the CDC. Kind of like with, the changes, we saw CMS came out with their guidance 1 month, and then the next month, IDPH came out with theirs. I can't promise it'll be that quick or that slow, but I think we can expect there's going to be a little bit of time, and I want to make sure everybody's prepared for that, so they're not beating down the door as soon as the vaccine's given.